Bloating. Bloating is one of the most common symptoms that patients come to us complaining of, and they don't even know that it's actually fairly easily reversible, and they don't even know the underlying causes of it. So in this video, I'm going to briefly explain the three main types of bloating, and that may help you understand which system is in trouble and which system needs to be fixed. So the first category is bloating in the stomach. That's going to be characterized by burping or bloat with gas that comes out. The middle category is no gas, meaning you're bloated, you may be puffy, but the gas isn't really coming out, it's staying inside. Third category is flatulence, meaning gas is coming out. So the bloating where gas is coming out says that it's more in the large intestine. Bloating where gas is staying inside, can't really come out the mouth, come out the other end, is more going to be in the small intestines. And then of course bloating that's more in the stomach is going to be characterized by burping. So each of these systems can have issues that go wrong, and that can tell you how to treat those. For instance, if you have bloating that's characterized by burping, that most likely means you have an issue in the stomach. Something like low stomach acid or H. pylori infection or heartburn reflux. Something is going on in the stomach, and if you can treat that stomach, then ultimately the bloating will go away. The no gas middle, no gas coming out, the bloating inside, that's more small intestines. This is the most common cause of bloating in our practice. The main culprits being SIBO, SIFO, or low digestive enzymes. SIBO stands for small intestinal bacterial overgrowth, or SIFO is small intestinal fungal overgrowth. So if you have either of those, you have bacteria and fungus growing in your small intestines, and basically they're eating and digesting your food before you do, and they're creating a lot of gas as byproducts. And that gas stays inside, makes you look pregnant or bloated or whatever it may be, and you can't quite get that gas out. So if you can treat the bacterial and fungal overgrowth, the situation goes away. You can also have low enzymes, low digestive properties. If you don't digest your food, something else will, and that something else that digests the food may not be beneficial for you and may cause bloating. Then the last issue is, of course, if it's in the large intestine. Bloating that's in the large intestines looks like flatulence and gas. And that may be from not enough fiber or the wrong bacteria, not necessarily a bacterial overgrowth, but the wrong bacteria, the wrong fungus. And of course, last but not least is retained stool, which we see quite often. Retained stool just says that, hey, you've got stool that's in there that might have been there for a bit too long, and it's building up inside your system, and ultimately that old retained stool needs to come out. You can even have retained stool even if you're having daily bowel movements. If you would like to get to the root cause of your bloating, then click the link in my description, find out more about my practice, and get started with us.